When should you worry about a fever after surgery? Imagine going through surgery and feeling fine, then suddenly developing a fever. It can be confusing, but knowing when to be concerned is key to your recovery. A mild fever within the first 48 hours after surgery is usually normal. Your body's immune system responds to the trauma and inflammation caused by the operation. This early fever is part of the healing process and often doesn't signal a problem. However, if your temperature climbs above 101 degrees Fahrenheit or 38.3 degrees Celsius, especially after 2 days, it's time to pay attention. Persistent or worsening fever beyond the first 48 hours can indicate an infection or other complications. Watch out for signs at the surgical site. Increased redness, swelling, warmth, pain, or pus are signs of possible infection. A foul smell coming from the wound is also a warning sign. If you notice these, contact your healthcare provider promptly. Other symptoms that should raise concern include nausea, dizziness, confusion, difficulty breathing, coughing up blood, or a severe headache. Loss of appetite or sudden changes in bowel movements can also be signs of complications. Fever after surgery can sometimes point to issues like a surgical site infection, which may appear several days after the operation. Lung problems such as atelectasis, which is a partial lung collapse, can cause mild fever early on but usually improve with deep breathing exercises and movement. Urinary tract infections, blood clots, or medication reactions are other potential causes. If your fever is mild and occurs within the first day or two without other symptoms, you can often manage it with over-the-counter medications like acetaminophen or ibuprofen. Follow your surgeon's instructions for recovery. But if your fever is high, lasts more than a couple of days, or is accompanied by other concerning symptoms, don't wait. Contact your healthcare provider right away. They may perform blood tests, imaging, or cultures to find the cause. Treatment could include antibiotics, blood thinners, or oxygen therapy. Remember, a low-grade fever early after surgery is common and usually not serious. But a high or persistent fever needs medical attention to prevent more serious issues. Always follow your doctor's advice and report any new symptoms or worsening conditions immediately.